Hey everyone, it's Dr. Sammy back at it again with some more nursing content. Today we're tackling okay, whatever, you know what I'm talking about. Nursing diagnosis. We're tackling it today because sometimes it can feel like you're building an IKEA furniture with missing instructions and the wrong tools. Does that sound familiar? Don't panic. You're not alone. Here's the good news. Once you're able to crack the code to nursing diagnosis, you're going to go from what the heck is this to boom, nailed it. By the end of this video, you're going to be like a Sherlock Holmes with a stethoscope, solving diagnostic puzzles like a pro. Let's get on into it. Before we dive in and get into the nitty-gritty of nursing diagnosis, I want to let you know that I offer one-to-one tutoring for nursing students who are struggling with these tough nursing concepts or having difficulty staying on track or preparing for these nursing exams. If this sounds like you and you need help, comment one-to-one tutoring below for the booking link to grab your spot now. Welcome to the secret sauce of nursing, the second step in the nursing process where data meets action. Let me tell you why this phase is like the real MVP. First of all, because of the nursing diagnosis step, you are able to call out the key issues. You're able to spot how patients, families, and even an entire community react to health hiccups, both real and potential. You're able to find the culprit, where as a result of the nursing diagnosis, you can zero in on the root cause, aka the whodunit, of health problems. This is where assessment data gets its glow up. By pinpointing priorities, highlighting strengths, and tackling problems, nursing diagnosis transforms care into personalized and game-changing experience, whether it's preventing falls or leveling up quality life. Let's make some magic happen. Let me tell you something. When it comes to nursing prioritization, you got to think like it's an ultimate full contact sport. You gotta put your risk radar on where you're spotting hazards, crushing infection gremlins, and giving no mercy at all. Think patient first. Help them function, thrive, and actually enjoy life. You gotta be able to outsmart disasters where you're predicting problems before they even strike. And you also gotta be in action mode, staying engaged, not hesitating to make things happen. Stay sharp, stay ready, and own your shift like a pro. Let's go! The nursing diagnosis is actually one of your superpowers, believe it or not. It allows you to think ahead in PPMP. And no, I did not say pimp, but it allows you to predict, prevent, manage, and promote. It's like the nursing's crystal ball, where it allows you to master the game of nursing so you can catch problems early, crush risk factors, and keep patients thriving. And you're going to game up on your squad goals where your collaboration is going to be on point. You're going to be able to tag in doctors, therapists, and specialists, and whoever needs to be in a patient's care so that you can provide top level nursing care. Listen, from strokes to sepsis, you're not just reacting, you're going to actually be running the show. Let's address the major difference between nursing diagnosis, which is the problem identification, versus the medical diagnosis. Number one, medical diagnosis is the official disease label. Let's say, for example, heart attack. And this disease label will stick with the patient as long as they're experiencing it. Nursing diagnosis, however, is identifying how the patient is reacting to that disease or illness. Nurses tackle real-time struggles like anxiety because the patient may be feeling, OMG, am I dying? Or activity intolerance because the patient may be like, why are the stairs hating me? Because they feel like they may be climbing Mount Everest, for example. Another nursing diagnosis may be acute pain because, the chest is on fire, or knowledge deficit because the patient may be experiencing or asking, wait, what the heck just happened here? So bottom line, the doctors or the nurse practitioner name the health problem while the registered nurses determine how the patient is dealing with that problem, body, mind, and spirit. Let's unpack a little bit deeper the differences between nursing versus medical diagnosis. They're like the Avengers versus the Justice League of healthcare. Both are very important in healthcare, but they play very different roles. Let's break that down a bit. When you look at it, by definition, Medical diagnosis is like the detective of the healthcare world. They're all about identifying the disease. Think of it like identifying who done it in a crime story. They're like, oh, you got a heart attack. Got it. Whereas the nursing diagnosis is like the superhero sidekick. Instead of saying, yep, it's a heart attack, nursing diagnosis is looking at how the patient is responding to that heart attack. Like, oh, wait, you're freaking out. Can you even walk? Do you need some TLC? So when we look at the focus of both types of diagnosis, we can see that number one, the medical diagnosis focus on what disease the patient has. It's targeting the disease. It's all about the physical condition. Like, yep, you have pneumonia, let's get that treated. Whereas the nursing diagnosis is addressing the person and how they are responding to that disease. It's about how they're handling that disease. So they're like, okay, you have pneumonia, but are you in pain? Are you anxious? Are you struggling to breathe? Both types of diagnosis is going to be collecting data and cluster that data. A data cluster is like detective work where there's going to be gathering of clues to nail down a diagnosis of sorts. The only difference is medical diagnosis is going to be collecting hard evidence of what's wrong in the body. Like chest pain, short of breath, plus a funky EKG, that means you're having a heart attack. Boom, done. Whereas nursing diagnosis is going to see anxious plus gasping and clutching the chest, that equals acute pain from cardiac injury. Both are connecting the dot to treat the problem, which is the medical diagnosis, or the person, which is the nursing diagnosis. Doctors name the disease, nurses decode the patient's struggle. Y'all saw that nursing magic there? Alright now. Both types of diagnosis is going to identify the challenges that the patient is experiencing. Medical diagnosis is going to pinpoint the disease or the condition itself based on the medical assessment and diagnostic tests, and based on that, we'll treat the disease. So, for example, based on some diagnostic exams, the physician may see, oh, you're having a heart attack, let's treat with something like oxygen, medication, and monitor vital signs. Boom, done. Whereas nursing diagnosis, on the other hand, is going to see, oh, you're struggling with that heart attack, let's help you cope and heal with that. They'll see something like poor circulation from that cardiac injury and have a treatment plan of boosting the energy, oxygen, warming the patient up, and getting that blood circulation flowing. Bottom line, doctors treat the disease and the nurses are going to tackle the patient's experience. Both are in superhero mode, trying to save the patient's life. Medical and nursing diagnoses are like the ultimate dynamic duo when it comes to looking at how patient is responding to treatment. Medical diagnosis focus on treating or correcting the disease that is causing patient harm, whereas nursing diagnosis is addressing the patient's needs emotionally, physically, and socially. Let's take heart attack for example. Medical diagnosis is going to provide treatment such as medication, maybe some oxygen therapy, and blood work and diagnostic, all for the purpose of getting that heart pumping. Whereas nursing diagnosis is going to address patient care and address issues such as pain with pain medication, provide some relaxation therapy, and address family support, because stress and heart attacks are a bad duo, right? So now, medical diagnosis addresses the heart attack, whereas nursing diagnosis addresses how the patient handles the heart attack. Let me tell you something. One thing's for certain, two things for sure. Nursing isn't just about care. It's about smart, critical thinking. I hope you're ready to level up. First of all, you gotta stay sharp. You gotta keep a go-to list of common health issues. You see that lipid cut and that INCP y'all don't like to look at? Y'all should make good use of it. It's really gold mine. Trust your gut, and verify. Don't just depend on your gut intuition, but you gotta validate your intuition with your data that you collected. And another thing, don't be scared to ask for help. Okay, even the best nurses who's been in the game for centuries don't know everything. Okay, so don't be afraid to ask for help. And another thing too, stay flexible. Ditch that biased thinking that you have. Be open-minded and be able to adapt to changes, because one thing for sure, change is always going to be a constant in healthcare. Some key questions you should be asking yourself so that you can make sure you stay on point is my data complete and reliable? Do my findings make sense? And if not, let's make it make sense. Could it be something else? Have I listened to the patient's perspective? And am I documenting everything clearly for the team? Because while we know that teamwork makes the dream work, but if everybody's not on the same page, there's going to be some chaos. So the bottom line is this: if something feels off, trust yourself to dig a little deeper. Thinking like a nurse means catching the details, making sense of them, and taking action like a boss. Hey! Mastering nursing diagnostic reasoning requires you to talk, to listen, and then to diagnose. If you want to level up your diagnostic game, you got to understand it's not just about the patient's symptoms, okay? It's about the connection. You want the patients to spill the real tea when they trust you. And all it takes is just you telling them to tell me your story. The secret sauce to this is building trust. When you build trust, that's when you get the best information, okay? And then it requires you to listen actively so you can build a stronger diagnosis. And also it requires you to be respectful and caring, because this is when the patient feels heard. Great nursing is not just a science, it's an art. Once you nail that conversation, you will be nailing the nursing diagnosis like it ain't nobody's business. Like I said before, being a nurse isn't about just collecting information. It's about cracking the case. You're on the hunt for clues, also known as cues. They reveal hidden health issues. You got to get into the habit of spotting red flags. Not all signs scream danger. Some may whisper it. That's why you look for patterns, okay? Not just the single symptoms. High blood pressure may be normal for one patient, but it could be risky for another. Context is everything. Data clusters are your secret weapons, like I said before. One clue, meh. But a pattern of clues, now we're talking business, okay? For example, if a patient is refusing food and they're extremely fatigued, that could be a red flag. Trust the clusters, not the outliers. You gotta get into the habit of thinking ahead like a professional nurse. Great nurses, they are able to predict problems before they even explode. No fever, but a funky looking wound, that might be an infection brewing up. So that nurse will stay sharp and proactive. You might come to a final diagnosis. I need you to understand there are three main types of diagnosis. One is no problem. This is when you're going to keep it moving and reinforce the good habits, and this is known as the health promotion diagnosis. Now, another type of diagnosis is where there's possible problems. Now, it's going to require you to dig deeper and gather more clues. These are your risk factor diagnosis. And then a third type of nursing diagnosis is your actual problem. Now, with the actual problem, it's time to act, plan, intervene, and you're going to document. So this is where you're going to partner up with your best sources, which is the patient. They're not just here to be fixed. They're also a part of the team, believe it or not. Work with them, not just on them. Bottom line, you gotta think like a detective. Trust the patterns and always stay 2 steps ahead of the game. Let me help you step up your game and create a fantabulous nursing diagnosis. Yeah, I said fantabulous. When you notice a whole bunch of important patient information or data that screams health problem, listen, that's your moment to shine. This is where you're going to start to create and write your nursing diagnosis. Now, in order for you to do so, you are highly encouraged to use the NANDA list or list of terminology. This is like your go-to guide, your cheat sheet, It helps you enhance your nursing diagnosis so that you can choose appropriate issues that's tailored to your patient, okay? Now, remember, we talked about 3 main types of nursing diagnosis, all right? We said that there were health promotion diagnosis, which is all about the positive side, motivating the patient to boost their health and well-being. The risk diagnosis, which is all about being proactive when you recognize that a patient is vulnerable to or susceptible to something and you're acting before it becomes a reality. And then we also recognize that there's a third type, which is the actual or problem-focused diagnosis. This is when you have identified an undesirable response to a health condition. Now, in addition to the three types of nursing diagnosis, there are two or three parts of the nursing diagnosis. Of all nursing diagnoses, all of them have to have at least two parts. They are the problem statement, which basically describes the patient's health status and what needs to change. This is like setting the stage for what you're about to tackle altogether. And then you'll have to use the etiology, which is where you are going to dig deep and identify the root cause. This is where you get your detective work going on, okay? You're trying to identify the contributing factors of the health problems. And then the third part, which is optional, is your sign and symptoms. These are the clues that you can't ignore before you start writing your nursing diagnosis. You look at these signs because they're the first clues and the symptoms, even though they show up last in the when you formulate a problem statement. Okay, they basically paint a picture of what's happening inside of the patient. A. Discombobulated nursing diagnosis can lead to discombobulated patient care. Let's talk about some of these mistakes and how to avoid them. First of all, like jumping to conclusion and making a nursing diagnosis based off of one symptom. For example, you get an elevated heart rate, and based off of that elevated heart rate alone, you come up with a premature nursing diagnosis of impaired cardiac output related to possible heart condition as evidenced by increased heart rate. I know it sounded long, but after you collected more data, okay, you can possibly come up with a better diagnosis of maybe activity intolerance related to increased heart rate and low endurance as evidenced by shortness of breath with exertion. Why is this important? Because elevated heart rate could mean a plethora of things such as anemia, dehydration, stress, pain. So that's why it's important for you to gather as much clues as possible. Another nursing diagnosis pitfall that you want to avoid is bad data, because bad data can lead to bad diagnosis. Okay? For example, let's say you collected the patient's blood pressure as you should, and you wrote down 80 over 120 instead of writing 120 over 80. Now the patient has a fake hypertensive reading, diastolically speaking. Okay? So now you come up with an incorrect nursing diagnosis of hypertension related to high blood pressure as evidenced by a reading of 80 over 120. The correct thing to do is to write your symptoms or your data collection correctly, and then maybe you can come up with a nursing diagnosis of, for example, risk for ineffective tissue perfusion related to uncontrolled blood pressure as evidenced by inconsistent readings. Okay? So double check your numbers because a simple typo can mess up your treatment. Or another example of bad data collection would be an assumption. Let's say you had a patient who just came from surgery, and just because the patient is smiling, you assume that the patient is not in pain when their pain is really 8 out of 10. So you come up with an incorrect nursing diagnosis of risk for pain related to surgical wound because the patient is smiling. No. A better nursing diagnosis would be acute pain related to surgical wound as evidenced by the patient's pain of 8 out of 10, guarding and grimacing. So you want to make sure you trust the patient's report, not simply their facial expression. Bottom line, you want to make sure you collect as much data as possible before you make a call. Check all your patterns, not just one symptom alone, and then double check for accuracy because bad data leads to bad care. Trust the patient, not simply some expressions. Okay, always ask and assess. A common nursing diagnosis error would be using a cookie cutter diagnosis instead of tailoring that diagnosis to the patient's unique needs. For example, a nurse may assume that every cough is equivalent to a respiratory infection, ignoring other pertinent data such as allergies or environmental triggers. As a result, the nurse may come up with an incorrect nursing diagnosis of ineffective airway clearance related to respiratory infection. No, the correct nursing diagnosis would be something like ineffective airway clearance related to allergic reaction. Every patient is unique, so customize accordingly. Another diagnosis pitfall would be missing relevant information leading to incomplete puzzles. For example, let's say a patient who's diabetic was complaining of fatigue, but no one bothered to check the glucose level, missing that hypoglycemia, the incomplete puzzle. Now, as a result, the nurse may come up with an incorrect nursing diagnosis of fatigue related to unknown cause. No, the correct nursing diagnosis would be fatigue related to poor blood glucose control. To make accurate nursing diagnosis, you should never assume. Always tailor that diagnosis according to the patient's unique need. Gather as much data possible so you don't come up with the wrong conclusion, and don't be afraid to ask, assess, and verify. Some other nursing diagnosis pitfalls that you want to avoid is overgeneralizing. Try to keep it tight. For example, readiness for enhanced health. What is that? Okay, how? Be more specific. Instead, you could write something like readiness for enhanced health related to motivation to exercise and lose weight. Boom, specific and actionable. If your nursing diagnosis is so vague it could apply to anybody, then you know you're doing it wrong, okay? Another nursing diagnosis pitfall would be mixing up medical versus nursing diagnosis. Now, to me, that's like the ultimate sin. For example, writing something like diabetes mellitus type 2. That ain't your job, that's the doctor's job. Instead, you can write something like risk for unstable blood glucose related to missed meds and poor diet. Nurses deal with how the patients respond to the medical disease, okay? Not the disease itself. Now, another pitfall would be mixing up risk versus what's actually happening. You got to know the difference. Let's say a patient currently has a temperature of 103.5 and they got wound drainage, redness, and swelling. And then here you go writing a nursing diagnosis of risk for infection. Risk? No, it's actually taking place. So if it's actually taking place, you got to write something like infection related to surgical wound as evidenced by drainage, redness, and fever. Okay? Now, another mistake would be leaving out key information. Okay? Let's say, for example, the patient has chronic fatigue related to waking up at night. And here you go writing something like risk for fatigue related to chronic illness. No, risk. Okay, first of all, if they have the chronic fatigue, is no longer a risk, like we explained earlier. And you got to make sure you put as many pertinent information as possible, okay, without doing too much. So instead, you could write something like fatigue related to chronic illness and poor sleep as evidenced by frequent waking and daytime exhaustion. Okay? Don't just scratch the surface. Get as deep as you need to. Another pitfall would be diagnosis overload. Oh my God. Let me tell you something. Less is so much more. So let's say a nursing diagnosis is written as pain, impaired mobility, anxiety, risk for infection. Oh, no. Let's chill out for a bit. Let's deal with one problem at a time. So instead, you could write acute pain related to surgery. You're focused and more actionable, okay? deal with one issue at a time. Be clear, concise, and treatable. And then another example of a nursing diagnosis pitfall would be addressing the needs versus the response. Okay, so you write something like needs assistance with mobility. That's cool, but why? Instead, you can change your nursing diagnosis to say something like impaired mobility related to muscle weakness as evidenced by difficulty walking. So, bottom line, you got to be specific. You got to know how to differentiate risk versus actual problems. Keep your nursing diagnosis updated. And of course, more importantly, you got to prioritize what matters most. Don't ignore the real struggles that the patient is going through. Ignoring barriers to change is not appropriate. So, for example, instead of writing a nursing diagnosis such as ineffective health maintenance related to lack of knowledge, you could write something else such as ineffective health maintenance related to financial constraints and limited food access as evidenced by reliance on fast food. You shouldn't assume that knowledge is always the issue. Consider real life barriers such as money, culture, and resource. And also, another thing, you shouldn't forget the family role. Okay, so instead of writing a nursing diagnosis of ineffective coping related to caregiver stress, because it sounds like the patient's problem is alone, no, write something such as compromised family coping related to caregiver stress as evidenced by emotional outbursts and reports of feeling overwhelmed. Family matters. Caregiver stress affects the patient outcome as well, so don't leave the family out of the equation. Treat the whole picture, not just one piece. Some other nursing diagnosis disasters that you want to avoid include something like making legally risky statements, saying something like, patient will die soon due to advanced cancer. Are you a psychic? I know I like to say you guys are fortune tellers, but you're definitely not a psychic. You can't predict when somebody's gonna die. You can't predict when you can foresee somebody's is at risk for fall because of an unsteady gait, but you can't predict death. So instead, you can say something like ineffective coping related to fear of death as evidenced by verbalizing concerns about prognosis. You stick to the patient's response, not some false prediction. Another diagnosis pitfall would be labeling normal responses as problems, saying something like fear related to upcoming surgery. That's a totally normal human response. So instead, you can change that up a bit to say something like anxiety related to unknown surgical outcomes as evidenced by expressions of worry. Only diagnose if it's a issue that's impairing the patient's function, not just because it exists. I hope you understand that. Another diagnosis pitfall would be treating the symptoms as if it's a diagnosis, saying something as if like fever related to infection. That's just the symptom. So you can change that up and correctly state it as hyperthermia related to infection as evidenced by a temperature of 102 degrees Fahrenheit. You focus on how the patient is responding to an illness, not just listing the symptoms, okay? Another mistake would be diagnosing the unchangeable, saying something like paralysis related to spinal cord injury. You can't fix that. So instead, you can say something like impaired physical mobility related to paralysis as evidenced by inability to move lower extremities. So you want to work with what the patient can manage, okay? Work with what can be managed, like rehab, okay? Not miracles. All right. Another mistake is blaming the environment, saying something like poor lighting in the room related to risk for falls. So then you just could turn the light on. So fix this nursing diagnosis by saying something like risk for falls related to impaired mobility with environmental hazards. So, or you could say with environmental hazards such as poor lighting or clutter. Okay, focus on the patient's vulnerability, not just their surroundings. Or another mistake would be repeating yourself, saying something like impaired skin integrity related to poor nutrition and inadequate diet as evidenced by source. Bruh, we get it. Okay, so keep it simple by saying something like impaired skin integrity related to poor nutrition as evidenced by source on the sacrums. There's no need to be double dipping here. Keep it clear and simple. Another one would be passing judgment, saying something like non-complying with diet because patient is lazy and doesn't care. Ouch! A bit too much bias is going on here. Instead, say something like non-compliance with dietary regimen related to lack of understanding of health risks as evidenced by a patient's refusal to follow the prescribed diet. So don't pass judgment, just stick to the facts, okay? Make your diagnosis count. Be accurate, fair, and patient-centered. So here's the bottom line. By keeping these common errors in mind and making the recommended corrections, you'll be able to craft nursing diagnoses that are clear, specific, and focused on the patient's unique needs. Whether you're just starting out as a new nursing student or you're a seasoned pro, these tips will help you to write nursing diagnoses that lead to better patient outcomes and more effective care planning. So take charge of your nursing diagnosis and give your patients the best care possible that they deserve. Hey, the fun side of charting is actually the nursing diagnosis edition. When you think about it, documentation is like writing the patient's health history, but with fewer plot twists and more accuracy. Now, whether you decide to use the 2-part or the 3-part statement, the goal is the same. Record real or potential health problems in a way that makes sense for the care you plan on providing. Now, the old school rule used to be only use NANDA listed terms. The new reality is use whatever your school, your employer, your specialty requires, like the AORN, ARN, etc. The bottom line is you want to make it clear, you want to make it relevant and useful. Your future self and your coworkers will thank you. Seriously, the goal of the EHR or the electronic health record is to make life easier for the entire healthcare team. It helps everyone to see the patient's risk and current or long-term issues in a flash. When you document in the electronic health record, you can see the risk like risk for falls or problems like constipation, and they're already recorded by the team member. And you can add new problems from your own patient assessment, which makes communication super easy, keeping everyone on the same page. You can use it to set patient goals and decide on what interventions to try. You can also document when a problem is resolved, so the journey of the patient is actually tracked effectively. In short, EHR is your backstage pass to an organized, smooth running team. What's next? We're going to plan like pros. In the next upcoming video, we're jumping into planning and outcome identification. This is where we're going to learn to prioritize nursing diagnosis, master Maslow's hierarchy of needs, and map out rock-solid care plans with evidence-based nursing interventions. Don't miss that video. Your nursing skills are about to level up even more. See you next time. Thank you for watching. What's next?